Hi, Cervena.
Hi, nice
to meet you. Come on back.
Of course.
We're gonna go right in here. But we're excited to have Cervana in here in the office. If you don't know, at Cervena Fox on IG, check it out. Huge following, and it's for good reason. She is an international model, performer, and you're not doing a whole lot of travel now, so it's a good time to get this stuff done.
Definitely.
And she's no stranger to these kind of treatments. And she looks fabulous and maintains well, so she's going to look fabulous for a lot of years to come. She doesn't really need a whole lot, and that's the point of doing maintenance early, which I know you get.
Yes, completely.
And you've been maintaining well.
Yes. Mm-hmm.
So it's something that she does on a regular basis. And today, we're just going to do a little bit of Botox. It's been a little while, huh?
Yes, been a couple of months due to COVID and everything.
Yeah.
But that should not stop you.
Well, not today. It's not going to stop us today. So a little bit of Botox for the forehead and frown lines. And actually, you were talking about your chin.
Yeah, because I'm very expressive when I talk, and I always notice it always like curls up and kind of like, I don't know, goes like an orange peel, like looks like an orange peel. So if we could do something about that, that would be really
Yeah,
awesome.
for sure. What he's talking about is actually pretty common. That's called peau d'orange, orange peel, that you'll get a little bit of a furrow of the skin there, making certain facial expressions, and it crinkles in a certain way. So a little tiny touch of Botox, you stay silky smooth.
Perfect.
Okay, so just a little bit in the forehead, because you said you want to be flat, smooth, no movement whatsoever.
And I noticed that I get more of a wrinkle on this side because I can lift that one, but not.
Yeah, well,
I can't do it. I can't move that one. I'm like.
Let me see, raise up again. Okay, and we'll show that. Now frown for me. Yeah, that's gonna be good. And smile, big, big, big. All right, so you really don't need anything here, and you probably never will, because you just don't move a lot there.
No, not too much, no.
Yeah. All right.
And I use good eye cream as well. So.
Well, whatever you're doing for your skin, it's pretty good. I mean, the little inflammation that you've got notwithstanding, everything looks fab.
Thank you.
So, good job. But we're gonna get started doing her treatment, and if we take a look at your face, you can just rest your head back, get nice and comfy, there you go. And let me see you raise your eyebrows for me. So, a little stronger on this side. You can see more lines in the forehead when you raise, and not so much here. And that kind of jives with what you were telling me, that you can raise this one, yeah, like that. But this one doesn't move a whole lot.
Can't do that.
All right, and if we take a look at frown lines, go ahead and frown. And that's actually stronger. Give me a good one. There you go. Yeah, we're getting a little line here, a little one here, so relax. The good news is, because you've been doing your Botox, you don't get these lines here at rest right now. So as long as we maintain, you won't get those 11s everyone hates. So we'll take care of that today. And let me see you smile really big. You got the cutest little dimples, but you don't have too many lines here in the crow's feet. So I don't think that you're really ever going to get too much there, because even with the biggest of smiles, not a lot going on there. So thank mom and dad, you got good genes. So no Botox here, but we're gonna do a little bit in the forehead and a little bit in the frown lines. So we're gonna get started, and we use these cold rollers. If you guys have been following me for a while, you know we use these to chill the skin down. It also decreases the risk of some bleeding, because you said you tend to ooze a little bit. This will shrink down the blood vessels to little tiny size because of the cold, and it'll decrease the chances of us having that oozing.
I've never had anyone use that before. That's really cool.
Yeah, well, tell me what you think. I don't want to buy, I think they're great, but you tell me what you think. Okay? We're gonna get started, and we'll chill the skin down first. Here we go. Very cold. There we go. Raise your eyebrows for me. Good. And relax. Little pinch. Good. Pinch. Doing great. Right in the middle, little pinch. Excellent. Let me see you raise up again. And relax. Pinch. Good. Okay. You all right?
Yeah, I'm good.
Yeah.
You're fast. I love it.
Doesn't take long.
Thank you.
All right. And let me see you raise up again. And let's get this guy relaxed. Good. Little pinch. One of the areas that Cervana had treated before is her chin, and we talked about that. So go ahead and make, there you go. Just getting, tighten it up. There you go, the little kind of wrinkly appearance in the chin, and that happens just in speaking and saying certain words, making facial expressions. So a tiny bit of Botox on each side will smooth that all out. Let's do it.
Go for it.
Okay, relax. You hardly bled, by the way.
Oh, good. Perfect.
Little pinch. Good. And other side, pinch. There we go. Okay.
Thank you.
You're welcome.
Hi. How are you?
This is Ramzi.
Nice to meet you.
Okay. Ramzi is an absolute expert in lips, and so we're going to talk about the little bubbles that you've got, and we'll talk about using the hyaluronidase and how we can make it better. Okay? All right. So one thing that we talked about, but we haven't really addressed yet, is you've had lip filler before that didn't go so well.
No.
So what happened?
I just noticed that very quickly I had bubbles underneath my lip, and they just started forming, and I thought they would go over time, but now it's probably been about 1.5 years and they're still there. They don't really cause too much discomfort, but I do notice sometimes that I do catch it on my teeth and they do bleed sometimes. So,
Yeah, so they're in the way.
they're in the way a little bit, yeah.
And this happens every now and then. I mean, a filler can get a little bit too superficial. Sometimes you can get a little swelling when it's being done, depending upon how it's injected. And there are things we can do. So in order to talk about what we can do, I want to introduce you to Ramzi, my PA. Ramzi is going to take a look at you, and we'll see how we can help you with maybe some hyaluronidase injections. Might need to actually remove the little bubbles if that doesn't do the trick. And then once everything's dissolved and you're kind of smooth and ready to go, she is a master at giving you that really full, beautiful look.
So you've had your lips done how many times before? Just once, or?
No, I've had it done multiple times, probably the last like 4 years maybe. So once a year I'll probably get it done.
And you've never had to have anything dissolve previously?
Never had that done, no.
Okay. Do you know which products you've had injected?
Maybe Juvederm, but I remember this, the last time that the lady did my lips, she used a different one. I think it was the latest one from the Juvederm brand, but I'm not 100% sure on that.
Okay. And then when did you start noticing that you had these like bubbles? Was it originally from the first time or over time?
For the first time, yeah. Like it happened probably after a couple of months, and I thought maybe they'll go down, and they just never did.
Okay. I'm gonna take a look. That's underneath, right?
Underneath, yeah.
Okay, so if we take a look at the lips, what do you see, Ramzi?
So you can see here, this is this sort of bluish, sort of discoloration right there, and this
Little bulge.
little bulge. That's all the filler that's kind of been injected. I would say in this case a little too deep. And I think over time it just tends to pool in these little lines. It's really common that I see this happen with people that have had multiple lip syringes. In her case, it was after the first time, but it gets worse as you continue to inject if you don't do anything about it. It's not so bad in her case, but also I noticed a little bit of her upper lip. You can see the skin above her upper lip is a little thick over here.
Yeah, a little bit of bleed.
Versus, you know, if you're looking at the bottom lip, you can see there's a clear demarcation between the pink part of the lip and the skin here. But when we look to the upper lip here, you can see there's the pink part of the lip, and then the white part is there's kind of less of a significant difference, and it looks a little thicker here. And I see that a lot of times with certain fillers. They just tend to give that sort of thick, kind of mustachy look, so we're gonna take care of that for her.
Do you think that this can go away with just the dissolver?
Mm-hmm. Absolutely.
Yeah?
Yep.
Okay. And how many treatments do you think it would take?
Typically one. So the dissolver, there's no like pure science in if I dissolve X amount, then this much is going to dissolve, because I'm not sure. Typically, if I dissolve into those little bubbles, they'll go away with one treatment. Okay. Sometimes, depending on the filler that they use and how, what we call cross-link, which is like how many bonds they make in that filler.
It's the structure of the filler product itself.
And so things that are more cross-linked tend to last longer, but they also are harder to dissolve. They take more dissolver and sometimes more sessions. So the way that the dissolver works is I inject it in there and it starts working like immediately. It works within 5 minutes to do its job and dissolve the filler. However, it also triggers your own body's enzyme, so to work over the next 24 or more hours. Okay. So you'll notice initially you're gonna swell just because I inject your lips.
Right.
There's swelling involved. And then it will do its job. But then over the next 24 hours or so, you're gonna notice it's gonna go down more and more and more.
Okay. Yeah, it can take a week or two to know exactly how things will settle out, depending upon how much swelling you get from the injections.
And if you ever see like on Instagram when people are like, I did 5 dissolving sessions or 2, the reason why there's sometimes more than one is because it's not, like I said, an exact science to say, okay, if I do this much, it's going to get rid of everything. And sometimes after like the dust settles, let's say after a few days, it's like, okay, there's one little thing that needs to be sort of dissolved again. Okay. Most cases, people are always worried about their lip looking smaller, but really when I dissolve like these little balls, and then if I go on the upper lip a little bit, your pink part of your lip looks actually bigger because it's not being weighed down by that filler that's kind of migrated above it. Makes sense? So most people ask me like, when can you refill? I usually wait at least 4 days.
4 days.
Okay. But like probably a week is ideal because you don't want to obviously be undoing what you're doing if the dissolver is still working in between. Yeah. So today is Thursday, so like Monday would be the soonest, I would say.
Okay.
To refill you. And you would have to make sure that like everything is going.
Everything's good. Yeah, I swell a lot as well. My body, I don't know why, it just feels really bad.
Are you allergic to anything?
Yeah.
We were talking about that earlier.
Yeah, but I don't know, I just swell. Even when I get tattooed, any trauma to my skin, it just...
You tend to swell up.
Yeah, when I got my lips done, it just...
And that tends to happen too with the dissolver, where you'll be a little swollen and it's hard to assess like immediately in the first few hours how much it's working because your lips are swollen now.
So in your case, because you're going to be bouncing around a little bit, she was nervous about getting it done because of the pain for one, and the swelling for two, because you're going to be leaving town when?
Tonight at 7 o'clock. I have a show tomorrow.
Okay.
Like a really important show, so I've been a bit worried about that.
Yeah, probably not a good idea to inject
soon. I just don't know when.
Yeah, I probably wouldn't inject right before you have an important show because though it's not common, you could get a bruise from this, and that would make some asymmetric swelling. It would make it hard to hide.
Yeah. I actually do think it's similar. I don't know what it is, but people tend to bruise with helmets.
Yeah.
More so than
filler.
Actually.
You could poke my thigh and
I don't know if it's because
bruise
it's like dissolved and maybe dissolves something around the little tiny blood vessels and it makes them just...
So just think about it the next time you're going to come through, and we can do the block.
Yeah.
And you'll be a lot more comfortable. It may not take everything away, but it usually does.
Yeah. It usually is so significantly better, and it's a lot of times I'll see patients and I'll see them and I say, okay, I can tell before they even say anything that they need a little dissolving because they have like that filler. You don't really have that. You have just a little thickening. But they're very nervous about the lip. Usually love the idea. It feels softer. It feels lighter. You don't have that feeling that you feel with your teeth all the time.
So it's not that bad.
As far you're
not that bad to compare to other people with it.
It's not bad. It's not. I don't look at you and go, oh my god, it needs to be done today. No. Yeah. There are some people that I look at that I'm like, we need to do it today.
You're like, honey.
Yeah. But yours is not. No. It's something that I notice because I have the eye for it that maybe the average person may not notice. But it's if we were to continue to fill you over time and do nothing about it.
Yeah.
Something would look unnatural. Maybe you wouldn't pick up on it, and other people wouldn't pick up on it. But they would something about the human eye would say, maybe she's had lip filler.
Yeah, something's a little off.
You want to be like undetectable. You want them to be bigger and fuller, but natural.
Well, the other thing is if you continue getting injections in the same manner and it's not addressed, then you can eventually get scar tissue, which you can't just inject away with hyaluronidase.
And that's what I'm worried about. Like, I mean,
I don't think you're there now.
You're good on that.
It wasn't the latest lady that I had it done by. It was a lady before her that did it, and then she even said the same. She was like, "We can dissolve it if you want," and I was the one that said no.
A lot of times these days, like even as a practitioner, if people don't want to dissolve, I tell them like, no, I don't want it because what happens
add anymore.
You add more, and then it kind of compounds. It makes the problem worse.
Yeah.
Yes. Yeah.
You know, or if like the filler's found a way to migrate up or down, what you're doing is just it's going to find the
same pathways,
and it's going to continue to just go up or down. So it's like. I think the time when somebody recommends to dissolve, it's like just do it. It's you're gonna end up probably being happier anyways because you're not gonna be doing what I see you do like subconsciously all day, and it's gonna look softer and smoother and more natural, and it's an easy fix. It's just you have to have the time. So like give yourself a couple of.
Next visit is going to be better because it will sting, and with the block it'll hurt you less, and then if you get bruised, if you get asymmetric swelling, and it's going to take a week or two for everything to be totally smooth and set so you can be refilled, then you have the time.
I agree. Yeah. Thank you so much.
But it's not
I really
bad.
appreciate
You're beautiful and your lips are beautiful. So don't like worry thinking that you like have this. I notice it because this is what I do all the time.
Yeah.
Okay. And you're noticing it because you can feel it.
Yeah.
So it's not. If it was bad, I would say, okay, let's put on makeup for your show tomorrow and we'll do it today. But it's not. To me, it's not bad at all for us to be like.
And the bigger issue that you have is on the inside of the mouth. It's not so much the upper lip.
Your discomfort is
the outer part.
I'm just kind of noticing a little bit on the outside that I think we should, if we're going to do the inside, let's take care of everything.
Do it. Yeah. And when you do the dissolver, does it dissolve? Like, does it spread and completely dissolve my whole lips of everything, or does it just do the area?
It's kind of localized, but again, it's not a controllable thing, which is why sometimes it takes a few, because it's kind of in some cases I'll inject right into the little bubbles, and it will just dissolve those, and then the rest of the pink lip will be okay. And then sometimes it will dissolve a little bubble, and then it will dissolve a little above the bubble, and then not to the right of the bubble. It's like it's really
because it's doing it regionally. The effect is wherever that stuff gets to, and when you're injecting with a syringe, it goes into the tissue and kind of spreads the way it's going to go, which usually is okay because when you've had any type of extension of the original filler, it should follow a similar path. But
so then it's helping it really, because then it's kind of blocking the path that there is there.
You're worried about what a lot of people worry about is you're going to put this filler in and you're going to have no lips left.
You're not. It actually ends up looking better. Like I'm telling you, it looks better in melting. Especially when I do up here, it's like when I do this, your pink lip can fold up a little bit because it's not being sort of weighed down by this part of your upper lip. Does that make sense?
Yeah, of course.
So most people are super, like most of my girls are worried they've gone years without having their natural lip and they're like, I can't. And I'm like, trust me about it. And they'll text me the next day or DM me and they're like, it looks so much better, like I'm happier.
Well, it softens up.
And it doesn't look unnatural. So.
That's exactly it. It just looks more natural because when you take everything out, if it's been done unanatomically, where you're creating a prominence where naturally there isn't supposed to be one, that's when things look a little off. And if you're not a trained eye, you might not look and say, that's filler. You just would look and say, something's wrong.
Something looks a little off. That's what I was telling you. You don't want to end up getting to that point where people look at you and they think something is unnatural. They're not sure what. We want to just keep it all natural.
Okay. All right. So we had a nice discussion about dissolving filler, and actually I think we can really help you. And when you come back through town, because Cervana's all over the world all the time. Again, check her out at Cervena Fox in IG, and you're all over social media, right? So just check her out, and maybe in some of the future posts, those lips will really glow.
Absolutely.
Well, we're all done, and I hope it was a good visit for you.
Pain-free.
Excellent. So we always aim for pain-free. I'll take that every time. Next time we see you, whenever you're coming back through this part of the world, then we'll take care of the lips as we talked about. But your Botox is good for a while.
Thank you.
Looking smooth as you always have. And again, check her out at Cervena Fox and IG. Where else?
Facebook and Twitter as well, exactly the same, at Cervena Fox.
Excellent. Well, check her out. Worth looking into. And if you ever see her performing, check that out too.